Hello, hi, I'm Stanley Chia. I'm a cardiologist practicing at Mount Elizabeth Hospital. My subspecialty is in interventional cardiology. So I have interest especially in patients who present with complex coronary artery disease, acute coronary syndromes, and myocardial infarction, or commonly known as heart attacks. And our hearts have blood vessels as seen here in red. They are coronary arteries. If we magnify the view, this is actually a blood vessels. And in these coronary arteries, which are like pipes, you can start forming deposits called cholesterol plaques or atherosclerotic plaques. And these can choke up and block the artery. And when that happens, blood and oxygen cannot flow through the arteries into the heart muscle, and this causes coronary artery disease. Unfortunately, coronary artery disease can affect anyone and almost everyone. Of course, there are many risk factors for coronary disease. If you are growing older, if you are a male, if you have a family history of heart disease, you will obviously be at a higher risk. But of course, there are other risk factors that are what we call modifiable risks that can accumulate along the way, such as smoking, diet, obesity, high blood pressure, high cholesterol, and diabetes mellitus. And all these are significant risk factors that can elevate the risk of heart disease by several fold. The most common symptoms are chest discomfort. By chest discomfort, we mean by a tightness in the chest or squeezing sensation that can commonly be precipitated by exertion, such as running, jogging, climbing upstairs, or even with doing housework. Other common symptoms include shortness of breath, a feeling of not getting enough air or oxygen into the lungs. You can also feel sweating, tired, fatigued, or even confused on exertion. And for ladies or elderly patients or patients with diabetes, they very often have atypical symptoms of coronary artery disease. They may have chest discomfort, not in their chest, but they may have discomfort just in their jaw, the back, abdomen, or in their arm when they exert themselves. So symptoms in ladies are very often missed. Now, when a patient presents to us with possible heart disease, first of all, we take a detailed history to try to piece together their symptoms. Where are they more related to heart or to other organs? Now, if we want to be more specific to look at heart disease, we'll do special cardiac tests. A baseline electrocardiogram will give us a heart rhythm and to exclude a heart attack. Doing an ultrasound scan would tell us the heart function to make sure there's no heart failure or no areas of the heart that has been damaged by blocked artery. Common tests that your doctor may perform will include exercise stress tests or treadmill tests, where you run on a treadmill to look at how the heart works, PET scan, or what we call nuclear perfusion scan, to look at how well blood gets in the heart muscle. When we talk about coronary artery disease, it's down to blockages in the arteries. So if we want to visualize the blood vessels, there are actually two specific tests. A less invasive test would be what we call a CT, coronary angiogram. A CT scan has an accuracy of about 80 to 90%, and it can be done as an outpatient test in about 30 minutes to 60 minutes. If blockages are detected, then you may need to go to a more definitive test. The gold standard test is what we call a coronary angiogram. A coronary angiogram is a test where the doctors will have to admit you into hospital and use a very small 2 millimeter long tube that is inserted either through the wrist or maybe through the groin artery, and will pass a catheter all the way to the heart and take very clear and careful movie pictures of the blood vessel. And that will allow your doctor to determine if there's any severe coronary artery disease. Now, for vast majority of patients with heart disease, they are stable. So we always emphasize the importance of lifestyle modification. That would be regular exercise, having a good diet that is low in salt, low in refined carbohydrates, and low in animal saturated fat. Have adequate rest, drink lots of water, and monitor the simple things like your blood pressure, your diet, and get your sugars checked.